Why is comorbidity a big challenge in bipolar disorder? Comorbidity in bipolar disorder means having one or more additional medical or psychiatric conditions along with bipolar disorder. This situation creates significant challenges for individuals and healthcare providers. It complicates the process of diagnosis, treatment, and overall management of bipolar disorder. Bipolar disorder often coexists with other psychiatric conditions like anxiety disorders and substance use disorders. It can also be linked to medical issues such as hypertension, diabetes, and obesity. Research indicates that around 65% of people with bipolar disorder will experience at least one other psychiatric disorder in their lifetime. Anxiety and substance use disorders are among the most common. One of the main challenges of comorbidity is diagnostic complexity. Symptoms from additional disorders can overlap with those of bipolar disorder. This overlap makes it tricky for healthcare providers to accurately diagnose and differentiate between mood episodes and symptoms from other conditions. For instance, anxiety symptoms can linger even when a person is not experiencing bipolar episodes, complicating the clinical assessment. Treatment becomes more complicated when comorbid disorders are present. Integrated treatment approaches are often necessary. For example, substance use disorders can mask mood symptoms and interfere with medication adherence. Additionally, co-occurring anxiety or personality disorders may require extra therapeutic or medication interventions, making care more complex. Comorbidity is also linked to worse prognoses and outcomes. Individuals with comorbid conditions often experience an earlier onset of bipolar symptoms and a more severe illness course. They may face increased suicidal behavior and greater functional impairment. The presence of additional disorders raises the risk of relapse and hospitalization. Moreover, medical comorbidities, such as cardiovascular disease and diabetes, are more common in individuals with bipolar disorder. These conditions can lead to increased morbidity and mortality. Managing these medical issues alongside bipolar symptoms is crucial for improving overall health outcomes. Despite the high rates of comorbidity, many individuals do not receive adequate treatment for all their conditions. This is especially true in low-income settings. Less than half of those with bipolar spectrum disorders receive mental health treatment, and comorbidities often go unaddressed. Finally, comorbid disorders can significantly impact quality of life. They add to the burden of bipolar disorder, affecting social, occupational, and interpersonal functioning. For example, anxiety and substance use disorders can worsen role impairment and reduce overall quality of life. In summary, comorbidity in bipolar disorder presents a complex challenge. It complicates diagnosis, requires intricate treatment strategies, worsens prognosis, increases health risks, and often leads to inadequate care. Effective management calls for comprehensive assessments and integrated treatment plans that address both bipolar disorder and its comorbid conditions. Always consult healthcare professionals for personalized advice and treatment options.